It's a parent's worst nightmare. Your child, the one you've protected and cared for all their life, suddenly shows signs of something serious. You want to believe it's nothing, that it's just a phase or maybe something temporary, but what if it's not? Cancer in children is something no parent ever expects to hear. The word cancer is frightening enough when it's attached to an adult diagnosis, but it feels almost incomprehensible when it's your child. However, what if I told you that recognizing the early signs of cancer in your child could save their life? Early detection is one of the most powerful tools we have when it comes to fighting this disease. Children's cancers are different from those in adults, and while the causes can be unclear, there are warning signs every parent should be aware of. Cancer in children is more common than we think, and while the chances of your child being diagnosed are low, it's better to be informed. Understanding the signs and what steps to take can give your child the best fighting chance. Let's get into it and talk about what you, as a parent, need to know to protect your child from cancer. Before we talk about the symptoms, let's first address what cancer is and how it affects children. Cancer occurs when cells in the body grow uncontrollably. Normally, your body's cells have systems in place to regulate their growth. But in cancer, this system malfunctions, and cells begin to grow without control, leading to the development of tumors. These tumors can spread to other areas of the body, which makes cancer so dangerous. In children, cancer tends to behave differently than it does in adults. The majority of cancers in children are not linked to lifestyle choices. Genetic factors may play a role, but most of the time, doctors don't know exactly why a child develops cancer. Leukemia, brain tumors, and neuroblastoma are some of the most common types of cancer found in children. The scary thing is that cancer in children can often develop quickly, and when the symptoms do appear, they can sometimes be mistaken for something less serious, like the flu, or just a minor illness. That's why it's important to recognize those symptoms early. Now, let's talk about the most common types of cancer in children. Leukemia is the most common form, making up about 30% of childhood cancers. This is cancer of the blood and bone marrow. Leukemia causes the bone marrow to produce abnormal white blood cells, which affects your child's immune system. Common symptoms include fatigue, pale skin, frequent infections, and unexplained bruising. It's important to remember that these signs are subtle, and many parents might miss them, assuming it's just a cold or flu. Another common childhood cancer is brain tumors. The symptoms can vary depending on the tumor's location, but the most common signs include headaches, nausea, vision problems, and sometimes problems with balance or walking. These tumors can develop in different parts of the brain and often cause persistent symptoms like dizziness or unexplained pain. Brain tumors are difficult to detect right away, especially because their symptoms often overlap with other, less serious conditions. Lymphoma, which affects the lymphatic system, is also common in children. The most noticeable symptom is swollen lymph nodes, often in the neck, groin, or underarms. If the swelling doesn't go away after a few days, it could be a sign of lymphoma. Additional symptoms may include fever, night sweats, and unexplained weight loss. Another cancer to be aware of is neuroblastoma. This type of cancer develops in the nerve tissue, often starting in the adrenal glands. Children with neuroblastoma can experience abdominal pain, lumps in the belly, or bone pain. This cancer is most common in infants and young children but can also appear in older children. Now, let's get into the signs and symptoms to look out for. These are early warning signs that could signal the presence of cancer, and catching them early can be the key to successful treatment. Unexplained weight loss is one of the first signs that something could be wrong. If your child is losing weight without trying or without any obvious explanation, it could be due to cancer. Leukemia, for example, often causes weight loss because the body is fighting abnormal cells, leading to a loss of appetite and energy. Another symptom to watch out for is unexplained fatigue. Every child gets tired, but if your child is suddenly more tired than usual, and no amount of rest seems to help, it could be a sign of a deeper issue. Persistent fatigue that doesn't go away, even after sleep, could indicate leukemia or other cancers. You may also notice unexplained bruising or bleeding. If your child's bruises seem to take longer to heal, or if they're developing bruises without any obvious injury, it could be a sign that their platelet levels are low, a common symptom of leukemia. This can also cause frequent nosebleeds or gums that bleed easily. Pale skin is another symptom you should keep an eye on. If your child looks paler than usual or has a persistent pale complexion, it could indicate that their red blood cell count is low, which often happens in leukemia. This is usually accompanied by other symptoms like fatigue and shortness of breath. Sometimes, children will experience swollen lymph nodes. These are lumps that can appear in the neck, underarms, or groin. If these swollen lumps don't go away or continue to grow, it could be a sign of lymphoma or another cancer affecting the lymphatic system. So, what do you do if you spot any of these signs in your child? The first thing is to stay calm. Many of these symptoms could be signs of other, less serious illnesses. However, it's always better to be cautious and get your child checked by a doctor. If you notice any of these symptoms and they persist, it's important to schedule an appointment with your child's pediatrician. The doctor will likely perform a physical examination and may recommend blood tests to check for any abnormalities in your child's blood count. They may also recommend further tests, such as X-rays or an MRI, to look for signs of tumors or other issues in the body. If your child is diagnosed with cancer, early treatment is key. While we can't always prevent cancer, there are ways to reduce your child's risk. Providing a healthy, balanced diet with lots of fruits and vegetables can help strengthen their immune system. Reducing their exposure to toxins and chemicals can also lower the chances of developing cancer. For example, avoid excessive exposure to pesticides or harmful chemicals in cleaning products. Encourage your child to stay active and maintain a healthy weight, as obesity is a known risk factor for several types of cancer. Regular exercise, even something as simple as walking or playing outside, can make a huge difference in reducing cancer risk. If you have a family history of cancer, you might want to consider genetic counseling for your child. Some cancers, like breast cancer and colon cancer, have hereditary components. A genetic counselor can help assess whether your child is at an increased risk and guide you through the process of genetic testing. If your child does have a genetic mutation that increases their cancer risk, early screening and monitoring can catch potential issues before they become serious. For example, certain gene mutations can increase the risk of breast or colon cancer later in life, so regular screenings become an important part of staying healthy. The most important thing to remember when it comes to childhood cancer is the role of early detection. The earlier cancer is detected, the better the outcome. Pediatric cancers are often treatable, and with the right treatments, many children go on to live long, healthy lives. If your child is experiencing any of the signs we've discussed, fatigue, unexplained weight loss, frequent infections, or swollen lymph nodes, take them to a doctor right away. Early diagnosis is key to effective treatment, and the sooner you catch it, the better the chances of a full recovery. As parents, it's easy to feel helpless in the face of something as serious as cancer, but knowledge is power. Recognizing the early symptoms and acting quickly can make all the difference. Stay proactive, educate yourself, and don't hesitate to consult with a healthcare professional if something feels off. Your child's health is your priority, and by staying informed, you're giving him the best chance to thrive. If you found this information helpful and want to stay up to date with more health tips and ways to protect your child, make sure to subscribe for more. Let's keep our kids healthy and strong for the long run.